Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
As usual, Instagram pops up faster. Don't know why. Just giving everybody time to tune in. I know some people find it annoying that we have music for a minute, but it just allows people to know that we're live. Allows them to get their notification.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax,
Morning, Gwen.
and enjoy the show.
My daughter's watching. Okay, welcome back for the second day of Kidney Week. Today we are going to talk about the symptoms of kidney disease and testing that can be used to diagnose kidney disease and to monitor progression of disease. So I'm going to read a little blurb first. When disease or advanced age causes the filtration process to become inefficient and ineffective in the kidneys, blood flow to the kidneys is increased in an attempt to increase the filtration. The body must increase the amount of blood flowing through the kidneys since less and less of the toxins are being removed each time. This results in the production of more urine. And to keep the dog from becoming dehydrated due to increased fluid loss in the urine, thirst and water consumption is increased. Therefore, one of the earliest clinical signs of kidney failure is increased water consumption and urination, and is called compensated renal failure. After approximately 2/3 of the kidney tissue is destroyed, then there's a rapid rise in waste products in the bloodstream and an apparent onset of sudden disease. So the process has actually been going on for a long period of time, but we detect it as something acute and a sudden onset. But really, I used to describe this, particularly with kitty cats, is that they're walking along the top of a fence, and as long as they keep their balance and they keep drinking enough and urinating enough, they can stay on top of that fence. But then at some point the load becomes so heavy on the body that they tip off the fence, and suddenly we perceive it as a new big problem, when in reality that problem has been teetering on the edge for a very long period of time. Okay. All right, so symptoms of kidney disease. The signs of acute renal failure and chronic kidney disease are actually fairly similar because, like I said, we don't really notice until things have progressed. The main difference is that the acute form comes on fairly quickly within a few days, while the chronic form develops over a longer period of months to years. So early indicators of kidney disease include that increased thirst, increased urination, maybe some lethargy, loss of appetite or decreased appetite or getting picky about their food, nausea, so they may actually start vomiting, drooling, diarrhea, weight loss, especially seen in chronic kidney disease. And I have to say, I think we see that more in the kitty cats where we get this muscle wasting than we do in the dogs. I think cats hide their disease much better than dogs, and by the time we figure out there's something going on, they have a lot more muscle wasting. With the dogs, maybe we're just more astute. Cats aren't big drinkers anyway, so sometimes we don't notice that our kitty cats are at the water bowl. They're kind of stealth drinkers. We don't normally see them. Whereas dogs are kind of like, yeah, I'm just going to run back and forth to the water bowl. I'm going to tell you there's a problem. Plus, dogs drink more at one time, so the water bowl will empty more quickly. Whereas a kitty cat going over and drinking more than normal may not make that bowl decrease. If you're using a water fountain, you may not notice that the water level is going down, particularly for kitty cats. So I think part of it with the cats is that we are just not quite as observant, and they're better at hiding things. But as the disease progresses and more toxins build up in the bloodstream, then the signs will worsen, and we may start seeing signs of dehydration. We may get high blood pressure, ulceration of the mouth or the digestive tract, and that ulceration will cause a very foul odor to the breath and will contribute to even more anorexia or loss of appetite. And if we have enough ulceration in the bowel, we may see those dark, tarry stools. It's rare to actually see blood in the stool, but you might see black in the stool, which is digested blood from ulceration higher up in the digestive tract. You may see blood in the urine. You may see an inability to regulate body temperature. A lot of these pets become very cold, so they sleep curled up in little tiny balls. If they get dehydrated enough, dehydration is actually painful. So particularly with cats, there's something called the grimace scale, and I think I've talked about it in the past. But we see this in cats when they get dehydrated. And so they get kind of squinty eyes where the forehead becomes wrinkled, the ears get flatter, the whiskers droop, and they just have this grimace of just, I hurt. So, look at your kitty cats if you have them and notice, and you can look up that pain grimace scale. I've got it on blogs on the website, but you can just look it up. It's called the pain grimace scale. Dogs have something similar, but it's not been studied as well as this grimace scale for kitty cats, and it's really quite telling. And so I think that if we were more in tune with seeing what our cats are doing, with that pain scale, that could be a good indicator of dehydration. It also is, can be a pain for anything else in the body, but a lot of times it is dehydration. The other thing that we will see, particularly in the kitty cats, is failure to groom. So their coat starts becoming clumpy because they're not grooming themselves so well. Part of it is they just don't feel well. If they're dehydrated, they don't have enough spit to really be grooming that coat very well. And if they're getting ulceration in their mouth is too painful for them to groom. They can get pale gums because we can get anemia secondary to kidney disease, particularly advanced chronic disease, and also seizures because the ammonia levels in the bloodstream, the nitrogen waste product levels, can get so high that they actually cross the blood-brain barrier, and in late-stage disease we can get seizures, and that is an end-stage problem when you get to that point. So with acute renal failure, these signs can worsen rapidly over a period of days. In chronic kidney disease, it's a period of months to years. Okay, so how are we going to diagnose kidney disease? So now we kind of know what we're looking for, but remember, by the time we're seeing these signs, we've got very late stage disease or very advanced disease, in that 2/3 to 3/4 of the kidney function may be lost by the time we're starting to pay attention and notice that there's something going on. So it's important to know that, the disease can be going on for a very long period of time before we notice. And this is why it's so critical that we get those annual or semi-annual lab results on our animals and have a good physical exam and blood testing done so that we can pick up these things earlier rather than waiting till they've already lost 2/3 to 3/4 of their kidney function. So certainly if you're noticing increased thirst and urination, you're noticing lack of appetite, picky eating, get them in, get some blood testing done. So what we're going to be looking for, we want a CBC, which is a complete blood count. And that is going to let us know what that red cell count is doing. The red cell count will drop in chronic or late stage kidney disease because the kidneys are responsible for producing a hormone called erythropoietin. And that hormone tells the bone marrow, hey, we need red blood cells. Could you kick some out for us? Make them, put them in the bloodstream. We need more. And when the kidney disease is advanced enough, that hormone is not being produced, that hormone is not available to tell the bone marrow to do its job, and so we will start seeing anemia in these pets. And if you're already to that stage, we've got some issues going on. So we do want to do that CBC, and that's something that we'll monitor as we're going along. We want to see what the red cell count is doing. We want to see what the hemoglobin is doing. If the hemoglobin is starting to drop, our iron levels may be getting low, and we may want to be proactive. Sorry, I have to let Stuart in. Speak of the devil. Okay, and so then we're also going to want a blood chemistry panel, and things in particular that we are going to be looking for in that blood chemistry panel. The BUN, which is blood urea nitrogen. That is the waste products that are in the bloodstream that are supposed to be filtered out. It's from protein breakdown. So when the protein breaks down, it breaks down into nitrogen particles, and we want those to be filtered out through healthy kidneys. If the kidneys are not doing their job, then that's going to build up in the bloodstream. Some labs will call it an SUN, a serum urea nitrogen. So SUN, BUN, same thing. We want to look at the electrolytes, which are sodium chloride, potassium, because those can change drastically. Sometimes the numbers can plummet and really be low because they're drinking and urinating so much, they're diluting them out of the bloodstream and peeing them out. On the other hand, in late stage kidney failure, sometimes that potassium can get very high, and if the potassium gets high enough, it'll stop the heart. So it's critically important when you have a blood panel done that it includes the electrolytes. And this is why I don't like mini panels or abbreviated panels, because we want those electrolytes on there. Don't leave them off. They're critically important as we're monitoring disease. And then another thing to watch in the blood screen is the amylase. So amylase and lipase are enzymes produced by the pancreas to digest starches, proteins, and carbohydrates. So we have protease, amylase, and lipase. We only measure amylase and lipase generally on blood screens. But the amylase and lipase are also filtered by the kidneys. So a lot of times when the kidneys are not working very well, the amylase levels will start to go up. And sometimes they're one of the earliest things that goes up. And unfortunately, too many animals get diagnosed as having pancreatitis, and they're being treated for pancreatitis, when in reality what we have is kidneys that aren't filtering well, and the amylase is going up because it's not being filtered by the kidneys. So it's critically important that we don't look at one lab value and make a diagnosis based on one. There are better tests available to look for pancreatitis. Amylase is not the test that we should be using to diagnose pancreatitis. So we want to monitor that, because that is giving us an idea of the kidney's ability to filter the amylase. Sorry, my tongue just got tied. And then a specialized test we're going to talk about in a sec, but then we also want a urinalysis. And in that urine, we are looking to see how concentrated is the urine. Are the kidneys able to either concentrate or dilute the urine? And we want to see the ability of the kidneys to concentrate the urine. And very commonly, I will get lab results from people that say, oh, my dog was diagnosed in kidney failure, and yet the urine is super concentrated. I'm like, well, his kidneys are doing a really good job. They're concentrating the urine, his CBC is normal, his amylase is not elevated, his BUN's a little high. What else could be going on? Is he bleeding into the bowel? Is he on a really high protein diet? Is he not processing the protein? So again, we can't use one specific test. We have to use everything combined. And this is where, if you take my lab course that we have on Dr. Judy U, we go into this kind of stuff in depth so that you really understand what you should be looking for and questions that you should be asking if you're starting to see something changing on the lab work that your veterinarian is kind of like, eh. Anyway, so besides urine concentration, we want to see, is there any protein in the urine? Are those kidneys leaking protein? And how significant is that protein that's being leaked in the urine? So if we're seeing protein in the urine, then there are secondary tests that can be run and should be run. One is called a microalbumin, and the other one is called a UPC. So the microalbumin is a more specific measurement, and we have normal ranges for that, because there are things in the urine that could falsely elevate protein. So if there's a urinary tract infection, you'll have false elevation of protein. If there's red blood cells in the urine from doing a needle stick to get the urine, that's going to give you a false elevation. So if we're seeing protein, we have to look at that in the light of how concentrated was the urine, how much protein is there, and how concentrated is it. And then we need to do a secondary test, either microalbumin or UPC, urine protein concentration. Anyway, and we know what the normal values are for those. And if those are elevated, we can track those after we're doing treatment or changing the diet or whatever it is that we're doing, and we'll talk about that later in the week. But then we can reevaluate these numbers and see how well our treatments are working, or how quickly the disease is advancing. Now, the other specialized test is called the SDMA, and that is a specific test owned by IDEX Labs, and it stands for symmetric dimethylarginine. And you can actually go to the IDEX website and look at their little algorithm. Maybe we'll get this as a download for you guys, where it basically tells you if the SDMA is elevated, what do you do? Because we're going to talk about staging kidney disease tomorrow, and the SDMA is used very heavily in that staging process. So somebody asked yesterday or last week, is the SDMA worth the price? Well, it's not expensive if your veterinarian normally uses IDEX Lab. If they normally use Antech Lab and then they only want this one specific test from IDEX, it's going to be more expensive. Personally, I used Antech in my office, and I didn't use SDMA. I looked at microalbumin, urine protein, the UPC, and I used other parameters to do my staging and my diagnostics. So you don't have to have this test if it's going to be horrendously expensive. The other problem is this test is not 100%. Now, what they say to us is that the SDMA can pick up the disease when there's only 25% kidney function loss, which is great, because knowing at 25% versus knowing at 65% or 75% kidney function loss, that would be great. We could be proactive, and we'll talk about that in the next couple of days, things that we want to do to be proactive. Unfortunately, if your animal is dehydrated, or if your animal is suffering from some other problem, shock, illness, vomiting, diarrhea, the SDMA can be falsely elevated. Too many times I get lab results from somebody saying, oh my gosh, my vet wants my dog or cat on a prescription diet because the SDMA, which normal is up to 14, it was 15 or 16, and all of a sudden the animal is sentenced to a lifetime of a low protein, horribly made prescription diet that is absolutely inappropriate for the animal at that stage. Well, again, we'll talk about that later in the week. But the recommendation is, if it comes up a little bit high, take your animal back again in a week or so. Make sure they are well hydrated and that they were fasted before the labs are taken. And let's see what that SDMA is doing, because it could be very different from 1 week to the next, from one day to the next, depending on the hydration level of the animal, the dietary level of the animal. So there's so many things that could contribute to that. So, and we can talk about it more in staging. But so if we get an SDMA that is slightly elevated, then we have to look for underlying causes, like we talked about yesterday. Is there an infection somewhere? Is there any kind of toxicity? Did the animal eat lilies, ethylene glycol? Did it, is it on non-steroidal anti-inflammatories? What else might be contributing to this? Like, is there something that's causing a kidney issue? So we should get a urine culture. We should maybe do some infectious disease testing for dogs, for lepto or Lyme, for kitty cats, for some of the viral problems. It's urine protein creatinine ratio. Gosh, dang it. I am a huge fan of ultrasound. If I get values that are high, whether it's, you know, if I've got all the indicators saying to me, look, this animal has kidney disease, BUN's up, creatinine's up, urine's dilute, there's protein in the urine, the SDMA is up, the UPC is up, the microalbumin is up, pick one, or well, pick a combination. And if we're looking at all that and saying, yeah, he's kind of got some clinical signs, he's got, you know, we've got lab values that are pointing to this, then my next step would be, let's get an ultrasound, especially if it's a younger animal. Do we have only one kidney? Do we have polycystic kidney disease? Do we have changes in the architecture of the kidney? Do we have indicators of an infection? So that would be my next step. I would be looking, particularly if there was protein or cells or high pH, I would definitely, in the urine, I would definitely be looking to get a urine culture. And then that abdominal ultrasound is so critical. And that's for young or old animals, because with the older animals, we can really, with ultrasound, we can get a good image of the kidneys and what they're doing and how much damage there's been to the kidneys. If they're small, if they're pitted, you know, what's going on in there. And then we also have to evaluate their hydration status. And I would also check their thyroid levels, particularly in kitty cats. Because we talked about yesterday that hyperthyroidism in kitty cats causes high blood pressure causes kidney disease. So, and then in both dogs and cats, we should check the blood pressure and see what's going on there, because if it is high, that's going to have to be treated. And whether we do it naturally or with medications, whatever, we've got to treat that high blood pressure, or we're going to continue doing damage to the kidneys. So, okay, that is how we are going to diagnose things. And then once we have the diagnosis, let's see, something here. Oh, we also want to monitor, protein levels and phosphorus. Oh, damn, almost missed this. So blood phosphorus will go up, and that's why with our kidney pets, it's critically important in their diets with the calcium and phosphorus. We have to work a little differently with that, particularly as the disease process progresses, and we'll talk about how we handle dietary phosphorus as we move through the week. But elevated phosphorus is a huge problem for these animals, and then we end up with osteoporosis because the body is trying to maintain the calcium phosphorus balance, and if we don't have calcium in the diet, then it's going to pull it out of the bones. Lots of secondary problems can occur. As you move forward with your animal, you're going to want to monitor all of these different blood parameters. Depending on the stage of disease, I would be monitoring blood parameters every 3 to 6 months at least. I really, in my practice, we've tried to monitor these animals every 3 months. I know it gets expensive, but it's really important to know if what you're doing for treatment is helping or not, so that you can make adjustments in your treatment protocol or your dietary protocol sooner rather than later. So tomorrow we are going to talk about staging of kidney disease. And the staging matters because it's going to dictate how restrictive we have to be with the diet, how much we have to change things, which supplements we may need to add in. So the staging is kind of important. It's a little complicated, and again, I think we're probably going to try to get you a download for that so that you'll have that in front of you, because it's a little more complicated, but it's nice to kind of have those parameters in front of you so that, again, when you get lab work back, you can look at it and go, okay, well, you know, my vet's not giving me much information, but based on this, I can say my animal's in stage 3. I think I need to make some adjustments. So, okay, everybody have a wonderful day. My music just disappeared. Where'd it go? There it is. Okay. That's why I couldn't find it yesterday. It's hiding. Things hide. All right, everybody have a wonderful day. I can't see these things. A change in water from tap to gallon, yeah, cause a change in how much our dogs tend to drink. Maybe. You know, not all bottled water is the same. pH differences and additives, you wouldn't think there'd be anything added to water, but a lot of them do have things added to them, so read the label. Alright, have a great day, everyone.